Hello, my name is Melanie Rubin. I'm a registered nurse for doctors Ira Papel and Theta Contis at Facial Plastic Surgery Center. We're doing this video to review post-operative instructions for nasal surgery. If you're coming in any kind of functional surgery or cosmetic nasal surgery, you are going to go home after that surgery and you are going to be on what we call bed rest with bathroom privileges day of surgery. We want you to sleep with your head elevated at least 30 degrees, and we want you to apply ice compresses to your eyes and cheeks. After nasal surgery, most patients will have tape across the bridge of their nose and or a splint. The reason we want you to put the ice on your cheeks is because you can't get your nose wet, because we don't want the splint or tape to come off your nose. And I'm going to show you what that might look like. The splint that we have, or the tape, is going to fit across the bridge of your nose like this. So when you put ice compresses on, you're going to put them on so it's covering your eyes and cheeks and not your nose, because if you get your nose wet, the splint or the tape might come off, and it's holding your nose in the shape that the doctors want it to heal. So make sure that within the post-operative period for 1 week after surgery, you do not get your nose wet. So you're going to put the ice on, you're going to have it like this. We usually recommend to our patients that you use frozen peas or ice cubes in a Ziploc baggie. I tell our patients normally just roll that baggie up and put it inside a white athletic sock. That way it absorbs condensation and it doesn't get your nose wet, and it gives you a little bit of buffer between your skin or your eyes and that cold ice. You're going to stay iced as much as you can tolerate for the first 24 to 48 hours after surgery. After nasal surgery, it's normal to have bloody drainage for a day or two after surgery. And one of the things you're going to do to help stay comfortable after that is you're going to use nasal saline spray that you were going to start using the day of surgery. So the nasal saline spray instructions are you're going to use 2 sprays in each nostril, a minimum of every 2 hours while awake. So when you use the nasal saline spray, it has a small tip on the bottle. It is an over-the-counter product. Any drugstore usually carries it. And when you use the nasal saline spray, don't put the tip of the bottle up into your nostril. You're going to hold it at the base of your nostril, squeeze it, and inhale while you're squeezing it. And you want to inhale so that you get enough of that saline spray up into your nose where you can actually feel it or maybe taste it in the back of your throat. That lets you know that you're getting enough of that saline where you want it. You'll be a lot more comfortable the more you use it, the better you're going to feel. Sometimes you need to clean your nostril edges because of a buildup of blood, and we will give you a solution of peroxide and saline to clean that with. So first day after surgery, bed rest, ice, nasal saline spray, and just, there's no dietary restrictions except no alcohol after nasal surgery. And then the next day, you can be up and walking around, but you still need to remember to keep your nose dry. You will have activity restrictions such as no bending over, no lifting anything over 5 pounds for at least a week after surgery. Sometimes after nasal surgery, you can expect to have bloody drainage, as I said, and we're going to give you some gauze pads, and you're going to make a drip pad for yourself to catch that drainage after surgery. So we're going to give you some of these gauze pads, and you are going to take the gauze pad and fold it into fourths. So you have a gauze pad. You're going to fold it in half, fold it in half again, so that it's like this. This can also be called a mustache dressing. And then you're going to take the gauze, and you're going to tape it under your nose like this. And you're just going to take a piece of tape and put it across here. The only function of this is to catch bloody drainage. If you're not having any bloody drainage, you don't have to wear it. But this will make it a little bit more comfortable for you post-operatively because we don't want you wiping at your skin if you're having drainage. So that's why we prefer that you use a drip pad. Things that you might want to think about after surgery, your normal post-operative swelling is that it will peak 2 to 3 days after surgery. Sometimes the tip of your nose is going to swell. You might have swelling on the inside around your eyes, sometimes even under your cheeks a little bit. Swelling like that is normal after nasal surgery, and also because of gravity and the location of your heart, you might notice that swelling and bruising might kind of just come down on your face a little bit before it goes away, and that would be normal. If you have any questions or concerns, you would want to give our office a call, and I hope this video has been helpful, and thank you.